Lung cancer is the leading cause of cancer deaths in Malaysia for both men and women. Your lungs are two spongy organs in your chest. The left lung is divided into two lobes, or sections, and the right lung has 3 lobes. When you breathe in, air enters your nose or mouth and passes into your trachea, or windpipe. At the carina, the trachea divides into 2 bronchi, then branches into smaller bronchioles. The bronchioles end in tiny air sacs, or alveoli. Here, the oxygen in the air you inhale passes into the bloodstream, and carbon dioxide from your body passes out of the bloodstream. The carbon dioxide is expelled from your body when you exhale. Your lungs are encased by pleura, a thin membrane that protects them and helps them slide back and forth as you breathe in and out. Underneath your lungs is the diaphragm, a smooth, thin muscle that helps your lungs expand and contract as you breathe. Your lungs are connected to small collections of immune system cells called lymph nodes by way of lymphatic vessels. You have groups of these lymph nodes near your lungs, above your collarbones, and behind your breastbone, as well as in other parts of your body. The lymphatic vessels carry bacteria, cancer cells, and other unhealthy material away from your lungs and other organs in a clear fluid called lymph. Lymph nodes filter this material out of the lymph. Lung cancers most commonly start in the bronchi, but they can also begin in the trachea, bronchioles, or alveoli.
Most lung cancers don't cause symptoms until the disease has advanced, but some of the most common symptoms can include a new cough that is persistent or worsens, or a change in an existing chronic cough, a cough that produces blood, pain in the chest, back, or shoulders that worsens during coughing, laughing, or deep breathing, and the last symptom is hoarseness or wheezing.
Other symptoms could be shortness of breath that comes on suddenly and occurs during everyday activities. Other symptoms can also be unexplained weight loss, feeling that you are tired or weak, or loss of appetite.
In order to diagnose lung cancer, you must go through a test. There are 3 different types of tests.
One of the tests is imaging tests, which can be an X-ray or CT scan to look for an abnormal mass or nodule. The CT scan may find things not detected on an X-ray.
The next is sputum cytology. This is looking at sputum that your cough produces under a microscope to detect cancer cells.
The last is tissue sampling, such as a biopsy, which is a sample of abnormal cells that may be removed during a biopsy.
In the first half of the 20th century, there were no known effective treatments for lung cancer. As time went on, some treatments have been discovered. Treatment options have changed little. The treatment options are still radiotherapy, chemotherapy, a combination of both, and surgery. Chemotherapy is appropriate for many cases. However, the thought on the matter is that the chemotherapeutic agents have reached a plateau. Surgery has gotten safer over time, and it offers a chance for cure. Surgical resection is the most common and successful option to help patients with lung cancer. The most common type of surgery is lobectomy. Due to advances in technology, video-assisted lobectomies are becoming more common within cancer centers, which promotes this less invasive method of treatment.
The best way to prevent yourself from getting lung cancer is to not smoke.
Are you okay?
I don't think so. I've had this cough for a while now. It seems to be getting worse, and every time I cough, my chest hurts, my back hurts, and on top of that, I've lost weight because I can't eat as much as I used to be, and my body always feels tired now.
Well, do you smoke?
Yeah, I've been smoking for around 10 years now.
Well, I think your best option is to go to the doctors, especially if you don't know about the symptoms. My uncle had the same problems and he was diagnosed with lung cancer.
Alright, do you think that would help?
I think it's better than not knowing.
The leading cause of cancerous death is lung cancer. 90% of lung cancer cases are due to smokers. Cigarette smokers are 15 to 30% more likely to get lung cancer. If you or a loved one smokes or has smoked, be sure to get a test done.